Well, right now in California, they've got a large outbreak of measles brought in through international travel. And because the vaccination rates are so low, they've had multiple secondary cases now being transferred to multiple states and one other country with measles outbreaks related to this. So we're now on a big push to see that everyone is up to date with their measles, mumps, and rubella vaccine. And it takes 2 of those vaccines to develop complete immunity. The vaccine itself is very, very effective at preventing measles vaccine, but because of our decreased rates of vaccinating the population, we're now starting to see outbreaks in measles brought in from foreign countries. Measles, first of all, is a preventable disease by vaccine. But what you don't realize is 1% of patients can become ill and die. Also, those who have immunocompromised immune systems are also at high risk for death and meningitis and encephalitis. There's also 1% of patients that will get what's called SPEE, subacute pansclerosing encephalitis, which can be lethal, and you can't predict who's going to get that. If we think back to the great pandemic flu epidemic during World War I, we recognize that the death rate there was only 1 to 2%, but it's all vaccine preventable. We're talking about the same death rate as the pandemic flu in 1912. So that kind of puts a better perspective with it, as far as, yes, people do die from this, and especially children, and we also have secondary complications such as blindness and encephalitis that's completely unnecessary and preventable. Now, if you're lucky and you're one of the 99 out of 100 that does great with the disease, then great, but woe be it to you if you're the tragic 1% with a child that has a major complication from it. Well, first of all, the vaccine's made privately. It's not made by the government, so private corporations are not going to do that. Second of all, the study that you're alluding to, referring to autism related to vaccines, particularly the MMR, has turned out to be a complete hoax. The doctor that wrote the study has had his medical license removed. His publication has been expunged from the record as all hoax. But we're spending a tremendous amount of time trying to undo the damage done by this unscrupulous report. Well, measles, and we've got the same story going on with pertussis, or the old-fashioned whooping cough. Whooping cough is caused by a bacteria that's in our vaccines, and it causes the old-fashioned whooping cough. Well, you and I, when we get whooping cough, we cough for 4 to 6 weeks, but most of us get better. But if we get whooping cough in a child, say less than 6 months, it can be a death sentence, particularly for children who may have asthma or underlying lung disease, cystic fibrosis. If they get whooping cough, it is a lethal event and is preventable by vaccine. And because in the western states there's been a lot more pushback to vaccines, and as a result, their herd immunity, which is looking at if you vaccinate everybody around a person who cannot have the vaccine and protect everybody around it, then that person can't get the illness because they're protected because nobody else around them can get them. And we like our herd immunity to be 80%, preferably 90%. Well, in some of the western states, these rates have dropped down close to 50%. And as a result, when a disease is introduced, there's enough people in that herd to have person-to-person propagation. And as a result, we see these big outbreaks of diseases that in the United States we haven't seen in a while. So measles and now whooping cough. Now with whooping cough, we actually have now recommended a booster dose in our teenage years, which leads us into, we'll talk a little bit about adolescent vaccinations here in just a minute. But we now want to get further vaccination of whooping cough in all pregnant moms, all adults. Remember when you went and got your TD booster, your tetanus shot? Well, now we're wanting to give it now in place of one of our tetanus shots as adults, in an effort to keep adults around children from transmitting the disease to those children who may not be quite protected yet. Now, adolescents are one of our special groups of people that we have difficulty vaccinating. We have difficulty getting adolescents at all to the doctor. They're usually well, they're doing great, they don't have much occasion to see the doctor. They usually don't do very well either getting their yearly checkups. We now have a few vaccines that we recognize that are important for teenagers to get. And we recognize they're a hard group of people to get into. But we now recognize Tdap, which is what we were just talking about, tetanus, diphtheria, acellular pertussis boosters, are important to keep that group of kids from getting particularly pertussis or whooping cough. But we now recognize there's two other vaccines that we need to get to the adolescents. First is the meningococcal vaccine, which causes meningitis. And that's the type of meningitis that you're well one day and you're sick the next day and you die on the third day. We see it in particular in college-age campuses where we can see outbreaks of this type of meningitis. And we now have a vaccine that prevents this type of meningitis, and as a result, by use of this vaccine, first of all in smaller children and now in our high school students, we're no longer seeing outbreaks of meningitis like this anymore. And then the newest vaccine that there's a little controversy over, but is still critically important, is the HPV, or human papillomavirus vaccine. And this is one of our first and very best cancer-preventing vaccines. If we get this to our adolescents early, before they can become infected with HPV, we prevent 8 to 10 different types of cancer in these young adults as they get older. One of those is cervical cancer, oropharyngeal cancer, penile cancer, anal cancer. All those cancers can be prevented by getting the HPV vaccine. It's a series of 3 shots. Of course, no shot is very pleasant, but it's a series of 3 shots that we want to get, particularly in males and females before the age of 21. We can give the vaccine up to 25, but certainly won't get it in them before 21, because once you get the virus, the vaccine does not work. So if you get one of these viruses, we can give you the vaccine, but then it won't protect you from the ravages of the cancers that this vaccine can cause. Oh, this is science fiction kind of medicine now. We're identifying what causes certain types of cancer, particularly understanding the genetic genome and learning the DNA layouts of these viruses. We're now able to figure out very quickly ways to overcome a lot of these cancers and diseases. We've done it now with a lot of childhood diseases, and now we're breaking the forefront with cancer prevention, particularly with HPV. But I think we're going to see a number of new vaccines on the horizon based off this genetic technology that is now coming out. Well, part of that, we've been very fortunate, at least in the state of Tennessee, we have a lot of required vaccines for school and to go to school, and then those are very important. We now have the vaccines that are required for 7th grade to go on into the 7th grade in our school systems. But I think as we get farther along and people become more educated and more comfortable with these vaccines, and certainly when we see these disease outbreaks, people are now becoming much more comfortable with going in and getting their measles, mumps, and rubella vaccines. We've talked about pertussis vaccine, and now we're talking about cancer prevention vaccines. I think the more data that we get and the more that we share this data, and particularly we see the benefits coming from this, I think people are going to be ready to accept them.